Hey, OncoPT, and welcome back to this episode of the OncoPT Podcast. We are continuing our APTA CSM 2024 preview sessions with our next exciting session, and I am so excited to welcome three very dynamic speakers to this episode. So first up, let's welcome back Dr. Rebekah Griffith, the EDDPT, to the OncoPT Podcast. Rebekah, welcome back.
Thank you. I'm so happy to be here, but I have to tell you, in this company, I'm not the EDDPT because we are all EDPTs. So I mean, I am one of many today, and I'm really excited about that.
Oh my God, I love that. So we're going to need you to change your little handle here. You can't be the EDGBT anymore in this conversation.
Well, I'm not smart enough to fix that, so
that's okay. We'll let it slide this time. I love that. So then, following Rebekah, we have a brand new speaker to the OncoPT podcast, Dr. Jenna Segraves. Jenna, welcome to the OncoPT podcast.
Thank you so much. I'm happy to be here. Just to give a little background about myself, I am a board-certified neurologic clinical specialist, so I'm very passionate about working with patients that have various neurologic conditions. And I am so excited to be talking more about having PT in the emergency department.
That is so exciting. Yay. And then our next speaker of the evening is Dr. Mark Magdaleno. Mark, welcome to the OncoPT podcast.
Yeah, so good to be here. Thank you so much for having me. I love the opportunity to be able to speak about our CSM presentation. So a little bit about myself is that I've been a bit of a generalist for my entire career. So I've had most of my career, which is 10 years now, in some combination of outpatient, inpatient, acute rehabilitation, and just kind of a broad generalist mentality, I would say, which was what draws me to the emergency room. And I've been here at UC Health in Aurora for about 7 years and been in the emergency room for most of that time.
Okay, I'm gonna go off script. I'm gonna ask a question. So I know Rebekah's kind of backstory into this, but Jenna and Mark, how did you find yourself in the emergency department as a physical therapist? Because that is, when I graduated PT school, that was not on my PT bingo card, and I didn't know it was a thing, honestly, until I saw Rebekah on social media. So I have a lot to learn about this topic.
Yeah, I would say standing on the shoulder of giants, right? It was not an opportunity that I had much of an awareness either until I started working here coincidentally. And would you believe it? Dr. Rebekah Griffith had started an ED program that was something that I showed some interest in and fell in love with it.
Yeah, Mark has been stuck with me that whole time, that 7 years that he's talking about, and he's still standing. And I have to tell you, he's one of the best clinicians I've ever worked with. So if you have need to learn particularly about vestibular, about how to simplify the complex, that is why Mark is part of this presentation, because he takes this calm, methodical approach and can take anything that feels really serious and complicated and break it down systematically to the point where it feels like a no-brainer. So he's absolutely going to crush this presentation.
I love that. All right, Jenna, same thing.
Yeah, absolutely. So I got into the emergency department because when I was actually applying for an acute care position, they had a growing need because they were well aware that having our services in the emergency department was so important. They were just starting to have too many calls for PT to come down to the ED. And so I actually interviewed for a position that would require a significant amount of my time to go down there. And I had never done it before, but my background with outpatient and also acute care, that nice blend, it really, I think, set me up for success working in that department.
Oh my gosh. So again, I think this is a really great intro into this topic because, again, even in oncology, I didn't know that oncology was a thing in physical therapy until I got to school and then happened into a CSM session that was on oncology. And so I'm hoping that maybe this is going to be like someone else's origin story of wandering into your session, and maybe 5 years from now, they'll tell the same story. So let's dive into your CSM session, which is titled Keep It Simple, management of the complex patient in the emergency department. Tell me all about it. This is so exciting.
I think to a certain extent, every patient that comes into the emergency department is complex, right? There's a reason they're coming to the ED. Sometimes it's socially complex. They may not have access to any other care. Sometimes it's medically complex. Sometimes it's psychologically complex. Sometimes it's just a really tough time in their life. So I would say that we try to approach every patient as the whole complexity of who they are as a human. But the rationale for this presentation really is there's been a lot of programming at CSM about here's how you get into the ED, here's kind of what you can do there. You know, this is what the research shows about the benefits. But for those physical therapists who practice in the ED, we want to help you level up. So the purpose of this presentation would really be to allow you to grow in your practice, to be able to take anything and anyone with any circumstances that walks through the door, and to know how to approach that in a comfortable, reasonable, and easy to manage way.
Yeah, I think there's just so much going on in the ED with respect to, biopsychosocial, different diagnoses, lots of crossovers with, acute care and outpatient and different populations such as, oncology. You can really get tossed into this buffet of patients and complex situations. So I think it's easy to overthink it a lot and really get stressed out. So I think that was, a great title that Rebekah, I think, created, Keep It Simple, in that it's a really good way to streamline a thought process and not to, get stuck with paralysis of analysis.
Oh, I like that. Paralysis of analysis. Yeah. And just to sort of add to that, I think that Rebekah and Mark have both just done a phenomenal job, really, of just kind of giving us a great nutshell of like what this presentation is going to be about. But we also have to remember that within the emergency department, the collaboration that takes place, the interdisciplinary communication is different than on other floors of acute care. And so I think it will also bring a deeper understanding and also a deeper appreciation of what that really looks like and how to really navigate that for those that are currently working in the emergency department. How can they make their time down there more efficient?
So then what was the motivation behind putting together this presentation? I'm going to pull something out that Rebekah said earlier, which is there's been programming on how to get started or how to get into this. And this is something I kind of see of an oncology too, of there's kind of a gap between here's what oncology PT is, and then there's like way up here. And sometimes I need in the middle. So I want to know what inspired you to present on this topic at this CSM in particular.
For me, it was last year I went to all of the EDPT content, which was great. There were people who were really like showing what they were doing, how they were doing it, how they had become successful. But for me, again, it was just like, I need to learn what to do next and how to be a better clinician in this space. And I think when you're speaking to that gap at CSM, is CSM the place to be teaching advanced skills? I don't know, right? Like, I don't know. Is CSM a tasting menu? Or is CSM where I'm going for my CEUs to advance my skills? Is a 2-hour lecture really enough? I don't know. But the other issue that exists, right, is this gap in continuing education for physical therapists who practice in the emergency department, period. So right now we are filling the space in the space that's available. And that's why this lecture should be such a nice follow-on to the content that was provided last year. So if you went last year to the EDPT or EDPT content and you were like, this is amazing, we are now ready to bring you to that next step.
That's so exciting.
Something that kind of inspired me really had to do with when I was at that previous hospital that I was talking about, where that I was there and was working much more often in the emergency department. We were trying to train some new grads to actually be able to go down there as well. And they were often getting very just overwhelmed, very overwhelmed.
Yeah.
And so this topic, this actual session, I think is really going to help tease it out to where it doesn't feel so overwhelming. It's easy to get lost in the complexities, but how do you pull yourself out and come back to sort of a framework to walk yourself through?
100%. It's that gap that everyone's talking about, right? There's not enough content to fill that gap to bring you from entry level or new grad to, a fully functioning emergency room PT. So it's a lot of on the job training. And I would say several years of on the job training when we notice that we have interest in our new grad population. So, it's just the content has not yet been developed to develop these young budding PTs with a lot of passion, but maybe a lack of confidence or a lack of certain skill sets.
Mm-hmm. Mm-hmm. And I really like the acknowledgement that y'all have of, because this is something I don't think I've really explored of, how much can you really do in a 2-hour session at CSM? But it's a start, right? And I think that's really important. And I think that's something that sometimes, even in oncology, I really like this approach of kind of what Jenna said of sometimes it's really complex and it's really complicated. It's very multi-layered. But what kind of a framework can you come back to make sure that, okay, I can rest in my assuredness of this framework as a basis or a foundation for me to then build upon no matter what I see in the ER? Because I imagine you'll probably see a lot in the emergency department.
Well, Elise, I'm going to tell you too that if anybody's listening to this and they're like, I'm absolutely not an EDPT, this presentation is still for you because we're going to take that same framework. We're going to apply it to any complicated patient, no matter what setting you're in. So if you're like, I'm a home health pediatrics PT, this is absolutely not for me. It is, because the framework we're going to provide to you is really through the lens of an EDPT, but it's applicable to any complex patient population. Anytime you're confronted with a patient and you're like, I'm not sure what to do, this framework will help you navigate your way through that. I think we've tried to make it so that you can really take your tool set and apply it with the right top of scope mindset, and then get that to the patient to get the patient the best that they need. So anybody, it really would benefit from this presentation.
I love that. So why is it so important, and you kind of answered this, but I'm going to keep asking this. Why is it so important for attendees to go to your session versus someone like a different one? Because we know this is a good topic, but tell me why.
I think it's the experience in this room. I would find it hard to duplicate the amount of EDPT that is within this wall during this session.
Mm-hmm. Ooh, I like that. Good answer, Mark.
I'm going to tell you, it's going to bring all the EDPTs to the yard also, I think. And so I think you're going to have this room full of experts in this area. And I anticipate a robust discussion from all of the EDPTs that come to CSM. And I cannot wait for that.
That's exciting.
And I think too that the topic itself and what we're talking about is also going to draw a lot of interest for students who are currently just learning about how to be a physical therapist, and maybe they're currently in a class about complex cases, and this is really going to set them up for success throughout their curriculum, but also to be thinking about a new and novel area that maybe they haven't learned about in school. It's not very often that this is even covered in the curriculum. And so I think that it could really spark some new frontier passionate therapists to come back to their school and say, listen to this talk I just went to. Why did we not learn about this in school? We absolutely should be in the emergency department. Let's spark change.
Yeah, I love that now that I'm thinking about that, because there's so many clinicians that, they have that passion, that fire when they realize that this is something new and novel that they, want to take on. Even, experienced clinicians who have been doing outpatient therapy their whole career, and they jump into something new, you can kind of see that fire that's been ignited. So I think it just takes a little bit of exposure sometimes to say, wow, that is cool.
It really does only take once. Again, I went to one oncology talk. It was the very first session of CSM 2016 in Anaheim. And I there was Elise before CSM and there was Elise after CSM, and Elise after CSM has never been the same because of this. So again, like, I love what Jenna said about let's spark change. Literally, this could be again, 5 years from now, this could be the reason that someone has like a whole interest and excitement and passion and like department they've built out. Oh my God, that makes me so excited.
I mean, that's my mission, right?
That would
like my
be
mission
so
is
cool.
to have a PT in every ED in the United States and urgent care. So if anybody walks out of this session with that as a goal, I'm 100% like behind that and here to help.
Oh my God. I just love CSM for so many reasons, but that in particular is one of them. Oh my God. Oh. Okay, so let's say that someone is coming into your session and they're like, okay, I'm going to learn a lot in here. I'm going to overload my brain, but what is one takeaway that you want someone to walk out of your session with confidently and say, I feel really good about this thing?
I have the skill set and the mindset, and I can really handle this as a doctor of physical therapy. This is my role, this is my place, and this is a space that we need to be in. And I think that also I want anybody who comes to leave realizing we need to go where the patients are, and we need to fill some of the gaps in healthcare because we're the right provider at the right time to do that. And as hope bringers, as professionals that make hope visible, the emergency department has to be a space that we're in.
Rebekah, do you know how powerful you are when you speak? I love your words. I just want to say ditto. Move past
Can you tell
me.
I like feel really strongly about this? I mean, I feel like a broken record, but like this is important.
No, but I love that. And I couldn't agree with everything that you said anymore. Something else though, just to add to it, because everything you said I agree with tenfold. I also want everyone to walk away understanding the importance of our role. So, everything that you just said, but also that like we should be on the team. We should be part of the actual team members because we identify things that others don't even know either how to look for it or they don't know what to ask. And so we spend that additional time with patients to where we can really get a deeper dive on some social determinants of health that could really impact their recovery. And then we know who to go to refer them to if there are additional needs outside of our scope that we can't help with at that time. We need to be there.
Yeah, and I hope people come away with the same passion that everyone here is speaking to, because I think it's sometimes easy to not be motivated if you're only seeing a certain patient population or only confined to these certain interventions that you're able to provide. But here in the ER, it's basically everything from social situations to manual therapy, and you get to really flex all those skills and become competent in each one of them. So you can walk away with this sense of confidence of like, I can manage any patient and I can help anyone no matter what their diagnosis or chief complaint is. It's really a rewarding place. And I hope that is like a contagious feeling that we can make known in our presentation.
I feel like EDPT is such a new frontier as someone who's not in it. Okay, so like, let me be clear. I feel like this is very much a new frontier of physical therapy because of what each of you said as far as what an incredible opportunity to meet people where they're at. Because when Rebekah was on the podcast previously, one of the things that she talked about a lot that has really stuck with me is, emergency departments are kind of the safety net of American healthcare. There is no further downstream that I'm aware of as like that is it. That is the hopefully catching the net of patients. And so what a tremendous opportunity and privilege to be able to show up in arguably what is probably one of the most distressing and vulnerable periods in some patients' lives, to then provide that hope and to be that beacon who can show up and say, I know that with my skill set and my mindset, I can help this person, no matter what they have. I may not know exactly what's going on, but I'm going to find out, and I'm going to find other people. Listener, the 3 people who I'm interviewing on this podcast right now who can help me with that. And gosh, that is so exciting. I mean, this is so much bigger than I think we think it is right now. I really do. Like, this has the opportunity to like totally transform American healthcare. And that is really, really exciting.
Yeah, you can feel it when you're in it.
Oh my God.
Like the analogy I use is that like just a little bit off course leads that ship into a completely different place, right? So
Yes.
if you make this change and you point this patient in the right direction from the starting point, then they have the ability to make that follow up that changes their life or improves their outcome in the long run, as opposed to just falling through that safety net.
Oh my God.
I think we're impacting healthcare on multiple levels also, right? So Mark, speaking to that patient's family member might be getting exposure to PT. But when you also think about it, our interactions with the nurse practitioners, the physician assistants, the physicians, the residents, the interns, the respiratory therapists, the social workers, the case management workers, for them to be able to see what we can do. The whole scope of it really blows their mind from whatever stereotype it is they have in their head about what a physical therapist is and what a physical therapist does. And so that opportunity to educate those providers to work in partnership and collaboration with them has ripple effects through care that multiple thousands of patients will experience over their lifetime. So I think that's a benefit too. And I think the other thing that Mark and I have noticed, particularly with our last pilot program, is we had to do patient satisfaction as one of our outcome measures. And we know patients are pretty satisfied in the ED. And it made us nervous to have to be like, here's the patient satisfaction survey. I need you to realize this is just about me. This has nothing to do with anything else in the ED. And even the times when I felt like we didn't help somebody, like they left the same way they came in, those were sometimes the best patient reviews. And it was the comments. It was like, God bless Mark and all of his progeny. It was like, the physical therapist made me feel like a human. First medical provider to touch me. Actually listened to me. Explained things in a way I could understand. I feel so much less scared now. Like, those are the things. So, I mean, when we talk about like, we're making like patient changes, even if all we're doing is adding some humanity into that experience, that's enough for me.
Wow. You know, Rebekah, I love that. And one thing that you just made me think of is that they've actually done research on those that have experienced trauma. And one of the biggest I guess reasons for people that feel as though they've experienced trauma is that they in the healthcare system, so this is specific to within the healthcare system, is feeling like they were not heard. And so what you just said, we can actually allow them to share their voice, share their thoughts, their fears, and to just feel like they have been heard. We listen. I love that.
God.
Yeah, and I think a lot of patients like the reassurance that's associated with our evals as well, and that if a standard emergency room, diagnosis might be low back pain, and they're discharged with still no understanding of what's causing their low back pain, no, estimate or prognosis on, is this going to be the rest of my life? Am I going to be paralyzed? Is this something that's, serious and uncurable? Or do you have the therapist go in and speak with them for, 20 minutes about, the inherent stability of the spine and how all of these things are bound to improve just based on, your youth and your lack of comorbidities. And this is something that's going to get better with graded mobility. It's really, I think, a lot to just educate the patient in terms of like at ground zero, instead of waiting, several weeks until they end up in a primary care clinic or outpatient physical therapy clinic, until they've had all these, fear avoidance behaviors and all of these, misconceptions. So they've had that opportunity to make this, terrible scenario in their head. Or you can just tell them right now that everything's going to be all right.
Oh my God. I might just go to the session for the quotables that y'all are dropping. I mean, we're in this, 30-minute interview already, just mic drop after mic drop.
It's because we have the coolest job.
Yeah, I would agree.
I'm going to assert that.
Oh my God. Okay, when is the session? Like, when can I register? When do I need to see y'all? Because come on now, let's go.
It is Thursday, February 15th at 11 o'clock.
Oh my gosh,
and it will
how
be available
exciting.
on demand after CSM. So they are going to
my
record that session as well.
That is so exciting. Oh my gosh. Okay, so again, y'all, their session, Keep It Simple, Management of the Complex Patient in the Emergency Department, is going to be happening on Thursday, February 15th at 11 a.m. They will be announcing the room assignments, I'm sure, very shortly. But oh my gosh, you guys, that was fabulous. Oh, okay, I'm going to go off script again and ask one more question of each of you. What is something for the clinician out there who is listening to this and thinking, this may be where I'm supposed to end up? Like, I think I'm supposed to be in the emergency department practicing, but I'm kind of scared about it. What is one thing you would just leave them with that would be encouraging, motivating during this uncertainty time?
That's a great question.
It is.
I would encourage them to use the sort of systematic approaches that we have applied in this setting, and then we're going to teach these principles in our talk, and just start to use this framework and kind of mold your perception of these patients. It's not just like a biomedical patient. Treat each patient as its own, IFC model, in that it's or ICF model, in that it's everyone is a biological system. They have a psychological health, they have behavioral health needs, and that they need a support system in place. So being able to think of each patient as its own, little body, and then address each of those needs.
Yeah, I think that I would ask them first, like, tell me exactly what it is that you're fearful of. Are you scared about the complex case? Are you scared about having to communicate with a lot of different healthcare providers? Are you scared about talking to your manager and trying to start a program because maybe it doesn't exist yet? What exactly are you nervous about?
Ooh,
But let's say it's the complex case because they're just really worried about that. Well, I like to, we will be utilizing a lot of case-based scenarios throughout our session. And so I think if you attend the session, that will really help you understand even some of the most complex that we will present. We will break it down into its more simple parts. And hopefully that will help kind of put someone at ease to realize, oh, maybe it's not as complex as I think it is.
I would just say, if you're thinking about it, if you're like, you heard this and you're like a little bit inspired and you're like, gosh, there's so much opportunity there, I would say, yes, you can. Bring your brain, bring your heart, bring your guts, and like, let's go, because the need is so great. And we need you. We just need you. The patients need you. As long as we're practicing in this payer-centered care model, like, patients are never going to get that care that they really need. And we have to start being that change, and we have to start going to where our patients are, because physical therapy should not be a luxury. It should not be something people have never heard of. And it should be something that gets to the patients who need it. And this is one way where we can get upstream at the bottom of the waterfall. So we need you. Welcome. Let's go.
Let's go.
Let's go. Like, full send, as my 14-year-old would say, full send.
Oh my gosh. Again,
I think
y'all,
we should all do that.
Right? Kind of at the end.
We'll have to practice that before the presentation.
There you go. There you go. I like that. Oh my gosh, you guys. This was phenomenal. Again, you can catch their session happening Thursday, February 15th at the second session of the day. It is going to be so impactful. I'm so excited for this. And thank you so much for making time to come on the podcast. This has been a really educational and enlightening interview, and I'm really excited to see where this goes and what becomes of it, and what future PTs are going to be at that session who are like, this is it. this is where I'm supposed to be. And that's really exciting to me. So thank you so much, y'all. I really, really appreciate it.
Yeah, thank you for having us.
Thank you so much.
We can't wait to see your presentation at CSM either.
Oh, yeah, thanks.